Hi, I'm Dr. Tim Maggs. I'm the Director of Sports Biomechanics at Christian Brothers Academy. I have been in that position since 2012. In 2017, we opened an office in the school, and in 2023, we stopped for a variety of reasons, but I'm very excited to inform everyone that beginning in March, I will be back at the school 1 day a week. It may grow to 2 days a week, but at least start out at 1 day a week. And it's very exciting. But I want to explain a little bit about it because a lot of parents and families are unfamiliar with what our role is. First of all, I want to just take you back and show you the history that we had, and it helps to explain what we do. The students at CBA, as well as students across the country, they go through a physical before a season starts, and it's a medical screening exam. There's virtually no tests done on the musculoskeletal system, such as looking at the feet, looking at the knees, looking at their leg lengths, looking at the range of motion, looking at the factors that will help to predict if there are areas of potential injury or areas of increased loading or weight bearing that will over time create a problem. So on the one particular Wednesday, this was my first these were my first four patients of the day, and it was just an absolutely tremendous experience having these families understand the importance of looking at structure at this age. So we want to fast forward a little bit. If you look at the fella to the far right, Jake, and here is a picture of Jake the last time I treated him before he graduated. So I have made so many wonderful relationships, and we really have impacted so many lives, but now it's today forward. We want to address all of the students and the student athletes at CBA and get them evaluated and get them on track for preventing injuries, but more importantly, understanding their structure better so they can do a better job in the future of taking care of themselves. Here's a picture. We had 3 tables this particular day. We had 3 students being treated at the same time. Now, what we do is we do an exam called a structural fingerprint exam, and it looks at the biomechanics of the student athlete. And here are biomechanics. You can see the imbalances originate at the feet. There's a domino-like effect going up the structure. The levelness or unlevelness of the hips, I call that the most important measurement in the body. And no one in our healthcare industry looks at it. We do, and we make sure that you understand if that is level or not and what we need to do if it isn't level. So we've named this structure Actuary Alex, and the reason is even at the young age of 5th grade at CBA, we can identify these imbalances, and these imbalances will have a cost associated with them. And by the time these young men reach the end of their life, they will have spent money, time, energy, pain, suffering, surgeries, drugs, because musculoskeletal is handled reactively in this country. It's not dealt with preventatively or proactively. So our structural management program starts with a structural fingerprint exam to identify these imbalances so that we can reduce the costs. So let me explain a little better. Actuaries quantify what most people never see, the hidden lifetime costs of physical breakdown, by projecting the financial burden of injuries, medication, surgeries, disabilities, lost productivity, and diminished quality of life. Actuaries make clear that musculoskeletal faults and imbalances are not just medical problems, they are long-term economic liabilities. Now here is a clear example of biomechanical imbalances. And I use this picture and the next picture just to give you a visual of what our goal is. Our goal is to identify these imbalances on the exam, and our goal is to improve them. And we have a variety of ways that we seek to improve them and then to monitor them. Now, we're also down there once a week to treat them because, again, our whole program is about proactive and dealing with, the small injuries, dealing with the athletes that aren't injured. There are treatments that we can do to encourage the health and the well-being of the young athlete. So if you go to sepoya.com, and Sepoya stands for Concerned Parents of Young Athletes. I've had this program now for 23 years. If you go to sepoya.com, you'll see this form. If you fill it out, you can fax it in, email it in, all the information is there. And that's what has to be done to then set up an appointment at our office. To be able to have your sons treated on a weekly basis, they have to go through the examination. Now, there is no charge for all CBA students for the examination and the x-rays and the explanation of what we found. If you decide you'd like to pursue any of the recommendations we make, then the charges are explained on that form or when you're here. Okay? Our goal is for every student at CBA to go through this exam, because what we want to do at CBA is use this as a model for what all schools across the country should be doing. We're neglecting this age group, and this program with CBA is designed to raise the awareness of the biomechanics of these young men and to give them a proactive plan on how to preserve the well-being of their structures, because as we all know, you need it your entire life. So don't just wait till you're 65 and you're broken down to seek help. Let's change the paradigm right now. Participate with me and let's get your sons examined, and then I'll explain to you what I would recommend, and you can make the decision if it's proper for you and your family. So thank you very much. I will be down at the school at the Meet the Coaches night with Coach O'Malley talking to the track team. If anyone else has any other questions, you can email or call our office, and we look forward to meeting with all of you. Thank you.